That's exactly where I would go with it. Like, this is a framework that, when I mentioned the behavioral plan from the Center for School-Based Mental Health, it wasn't a specific, this is exactly what you do. It's what components do you look at to make a successful plan. And so some of that I was talking about that's in the written is just school buy-in. Like, do you have administrators and leadership invested in whatever you're going to do? Do you have teachers invested? Are you collaborating with communities? So it's a very broad framework, but it's the kind of things that you keep in mind as you're developing a school-based mental health program. And so what I was saying is that kind of broad, like, best practices around using a framework are things that we were seeing in this bill. Not specific practices on the ground, because, Chair Price framed it best. It's really about creating a framework that would be helpful for schools to make these decisions on their own, while at the same time kind of looking at what evidence is out there.
Okay, but all right.
Well, and just to be the devil's advocate, that curriculum, or where that curriculum comes from, matters.
Right.
And it matters in the shacks currently are having a really hard time with all of the sex education programs because there's this controversy. And that's a different thing. That's a different thing.
I created the shacks.
No, I'm not saying the shacks are bad.
This is why it's really important.
I'm not saying the shacks are bad. What I'm saying is that curriculum.
It gives.
Well, but there are nonprofit organizations with agendas that have overtaken the shack. As a mother who's fought the sex education battle, I know what's going on in the shacks. And so when you bring in mental health issues and curriculum, then there are issues. Let's say that shack brings that in. Let's say you have a health class where now this curriculum comes in that talks about suicide prevention, all of these things, but where that curriculum is coming from dives into other areas, the LGBT if that's causing suicide. There's stuff that's coming in. When you shift to attitudes, values, beliefs, and behaviors, this is about behaviors, it becomes whose attitudes, values, beliefs, and behaviors, and that means anyone with an agenda, whether it's an agenda I agree with or not, doesn't matter. It's a matter of any agenda has access to our children, and me as a mother who sends my child to that school, if I'm not on that shack, but my child is required to take health in order to graduate, I don't have an opportunity to opt out of that. Just like.
And you think you should?
And I think I should.
Excuse me, Dr. Zeller, do you want to ask a question?
Well, no. The last thing I wanted to ask. So once let's say you find
Zeller, do you want to ask a question?
Yes.
And I recognize you.
Once you find out that we say, okay, we've identified a problem, what are you told to do with it under the program?
You know we're recording our testimony. I want to keep a clean record. You're laughing, but I'm serious.
Well, so what are you told to do with it under the plan?
Madam Chair.
What? Oh, I'm sorry.
No, the reason why we want to keep the voice, somebody go back and
Right, I understand. So,
okay, Chairman Price want to give you an answer to your question. Chairman Price.
I think the most important point I can say about the bill is it doesn't require anybody to teach any one thing or do anything. Now, I understand Ms. Linahan's concern, and I think that's a valid concern with regard to what third-party curriculum is a district or a state, for instance, going to adopt. And we don't get into that in this bill. We just basically say, look, we recognize the fact that, for instance, if you are teaching health and you're teaching about cardiovascular disease, which I think we all agree would be something worthwhile to teach our kids in the health class, we might also include suicide prevention. Let's at least acknowledge that health as a curriculum includes more than bruised knees or cardiovascular disease or obesity. It includes the brain. And so that could be concussion health. It can be all kinds. Brain health. It can be all kinds of things. We don't get into that in the bill. We do not say that has to be taught. What we do say is that if you're going to teach health, and we don't require it any more than it's already required, we say if you're doing it, then do it more holistically. Let's talk about health care. Let's just not talk about only physical health. Now, whether a district or a state, decides to engage somebody that not 100% of us agree with, that's not part of this bill. So we're not requiring anybody to do anything specific, teach anything specific with regard to that. That's not where this bill goes. So when you ask that question, I think it's important to understand that. While we might include mental health and physical health under the umbrella of healthcare, we're not saying you have to teach A, B, and C, or this opinion or this behavior. I mean, I think all that is outside the scope of this bill. But, if we're just limiting, what this bill does and doesn't do, we want to recognize that it's including physical as well as mental health, but it's not saying what parts of those components. That's not what we want to get into and mandate it.
I'll ask final question.
Thank you, Pam.
Thank you.